My name is Dr. Kennedy Brightson. I'm the director of the Shai-Osudoku District Hospital. The Shai-Osudoku District Hospital started from very humble beginnings in 1970 as a health post. It was established within the Se community in Dodowa. Se is what you hear today as Shai, and I guess the spelling as usual was S-H-A-I instead of S-A as we have in our alphabet. We worked as a health center from 1970 for 15 years, and then as the demand for better health care came in, the increase in population within the catchment area forced the government of the day to relook at the health sector, particularly for the former Dodowa district. And then we became a health center. From 1985, we operated as a health center until late 2009, when the demand for a better facility, increased health care, and continuous expansion of better life forced the government then to relook at the health center again, and we were upgraded to a district hospital status. From the district hospital status, we have worked very, very hard, and from a 50-bed capacity, we gradually won the heart of government, and we got a brand new structures. We got a brand new structure. This structure contains 125 beds. We have now increased it to 150 actually, but the total capacity is 300, and we can increase to 300 without necessarily expanding on the physical infrastructure. There are wards and there are theaters, 2 operating theaters actually. As a hospital, as a facility, we have a vision, and our vision is not very different from the vision of the Ghana Health Service. Out of the Ghana Health Service, we carved for ourselves that we want to become either the best or amongst the best district hospitals for the best quality of patient care, teaching and research in Africa. But then how do we do this? We're saying that we can do this through our mission statements. And the one is to provide quality health care services responsive to the needs of all manner of people living within the district and its environs. We would also like to implement, or we are implementing actually, approved health sector policies and prudently manage all resources available for the provision of services. The third point here is to provide a conducive environment for all categories of staff, and then make sure that they work in a clean environment. And when you come around, you walk around the compound, you will see the beauty of the hospital and the compound. It is not only beauty that we portray, but we work. We are a primary healthcare facility, and we have primary clinical areas that we work on. So we have a hypertensive clinic, we have a diabetic clinic, we have ultrasound care, we have ENT clinic, we have a dental clinic, we have ART clinic, we also have a family planning clinic, we have a community psychiatry unit, we have an eye clinic, we have theater, we have maternity. Maternity is actually the strength and the being of the hospital. And then we have the ANC clinic, and we have physiotherapy and occupational health clinic.
Yeah, Mama Kwabo. Yeah,
I'm Patricia Adipa, and I'm a midwife at the antenatal unit. One interesting thing we have at the antenatal unit is the pregnancy school. We enroll our mothers into this school for free. And we have levels. We have the level 100 that takes care of those who have just entered our clinic up to the 6th month. And that's when we meet them every second Saturday of the month. We educate them on certain things that they should know about their bodies, about their babies, about the pregnancy whilst they visit us. And we have the level 200. That is from the 7th month onwards till they give birth. And at that time, we meet them every Wednesday as they visit us. This is to enable them know the danger signs in pregnancy at the point in time where they are in. And then they are supposed to know the signs that they should see when they are getting into labor. We enlighten them on things that happen at the labor ward and things that happen at the theater. That is, if they are supposed to take a cesarean section, so that they will be at ease and they will not be scared when they hear the word operation. So these are some of the things that we do at the pregnancy school.
At the antenatal unit, we ensure there's cordial relationship between the midwives and the mothers. We provide privacy and there's less waiting time when you visit our unit. There are also professional midwives and doctors always available in case of any emergency. And we also try our best to do follow-ups on all our clients that visit the unit.
Hi, my name is Diana Nyako. I'm a midwife at the Shai-Osudoku District Hospital. I work here in the maternity ward of the hospital. In the maternity ward, we have 4 units. We have the prenatal ward, the labor ward, the NICU, and the postnatal ward. At the prenatal ward, we take care of sick pregnant women. We take care of women with gynecological issues such as uterine fibroids and bleeding in between menstruation. We also take care of women who are in labor. At the delivery ward, that is where we deliver our mothers. At the NICU, we take care of sick babies and preterm babies. At the postnatal ward, we take care of mothers who have delivered and are very happy. We also take care of our cesarean section mothers after they are back from the recovery ward.
I'm Ruth Katamanso, representing the Reproductive and Child Health Unit of the Shai-Osudoku District Hospital. At our unit, in the morning, we start by giving a health education to the clients gathered. In this health education, we give education to conditions that are prevailing in the community, and we encourage them to ask questions. From health education, we go to the growth monitoring. In growth monitoring, what is probably known as weighing, we assess the weight of every child, and then any deviation, we address it. From that place, we move to registration, where the details of every child and whatever services we have rendered is recorded both in the child's child welfare clinic book and then our notes book, so that it will help, or our registration book, so that it will help us to do future references. From there, we move to immunization. At birth, a child is given the BCG on the right upper arm, which will prevent the child from tuberculosis. The child is also given 2 drops of the polio vaccine orally, and it's supposed to help the child against, or protect the child against the polio disease.
My name is Samuel Ametefe. I'm the head of laboratory at Shai-Osudoku District Hospital. In this lab, we do so many laboratory tests. we examine so many laboratory samples. We examine blood samples, we examine urine samples, we examine stool samples, we examine sputum samples, cerebrospinal fluid samples, and then semen samples. And we have qualified medical laboratory scientists working in the various departments in this laboratory. And basically we have 4 departments in this laboratory. We have the hematology department. So many tests are done under the hematology department. To mention a few, we do full blood count, blood film for malaria parasites, we do sickling tests, we do HB electrophoresis, blood grouping, erythrocyte administration rates, just to mention a few. And then also, we also have the microbiology department where so many tests are done. For example, we do urine CS, stool CS, blood CS, cerebrospinal fluid CS, and then semen CS, just to mention a few. There are other tests that we do. And then also, when you come to the chemical pathology department, so many tests are done. For example, liver function tests, and then renal function tests are also done to find out how well your kidney is functioning. And then we also do the lipid profile test, your uric acid, and then we also do the hormonal assay, where we look at the fertility investigations. And then we also do the PSA test to investigate prostate cancer. So apart from the chemical pathology department, we also have the blood banking department, where blood donation takes place. We have a place for bleeding of blood, donors walking, and then we bleed them of the blood. And then we also have a place for screening of the blood sample that we have already bled. And then after the screening, we screen the blood of HIV, hepatitis B, surface antigen, hepatitis C, virus, and then syphilis. After the screening, then the blood is ready for transfusion. So basically, these are the few things that we do at the Shai-Osudoku District Laboratory. Apart from all this too, we also ensure that we do internal quality control. The internal quality control will help us to know how well our analyzers are functioning, whether they are functioning well or not. It will also help us to know whether our reagents are in good condition. And then also the internal quality control will also ensure that the results that we have given out are good results, reliable results, and of good quality.
My name is Auntie Vivian. Everybody calls me Auntie Vivian. And the pharmacy deals with everything drugs about the hospital. We don't only do dispensing, like you all know, but over here, we do our own preparations. We manufacture, basic essential medications. So, for a first timer, and you are given a prescription to come to the pharmacy for medications, you may not know where to start from. First of all, you come, you drop in your prescription together with your insurance claim sheet if you are insured. You have a seat patiently, you'll be called. We'll go through the prescription. If we have the medications, we'll key it into our system and then we'll inform you as to how much you would have to pay. If we don't have, which is not very likely, we would inform you and then straight away you go elsewhere to buy. At the Shai-Osudoku District Hospital Pharmacy, we always encourage you to abide by simple rules that will make you feel better. I want to give you just 5 key points. 1, complete your course of medication. 2, remember to take your medication on time. 3, when you are done with a full course of medication, always come back to the clinician for review. 4, keep your medicines out of reach of children and remember to store in a cool, dry place. 5, keep all suspensions in a fridge.
My name is Gloria Sarkodie Adu. This unit is Stay Healthy unit. What we do here is to help people walk through the hospital and do checkup. The things I do here is 1, I use this pulsometer to check your oxygen saturation. When I say oxygen saturation, I mean the amount of oxygen flowing through your blood.
I'm the head of Total Quality Management in Shai-Osudoku District Hospital. Our main aim here is to deliver quality care to all manner of clients that comes here, be the rich, the poor, the black, the white. Irrespective of where you are coming, we make sure you get equal rights of healthcare services. What we also do is to monitor, we have a routine monitoring of all our equipment and the machines we work with. We make sure we service them on a monthly basis for it to bring out good results.
Ladies and gentlemen, our brothers and sisters, our mothers and fathers, our aunties and our uncles, our cousins, our friends from within Dodowa and without, our friends who are also foreigners. We are saying that the Shai-Osudoku District Hospital is for you for the taking. You just come in and get the best health care. You come in here, you look at the environment alone, and I bet you would love it. It's so green. And you don't even come here when you are sick alone. We also have another department called the Preventive Health Department or Get Well Clinic. You don't need to be sick. You can come and just say that, doctor, nurse, I'm not sick. I just want to know how well I am. I want to check my blood pressure. I want to do this, I want to do that. And Alberto, I want to see if I can be able to chew some chicken or some goat or eat some fufu or some rice this coming Easter or this coming New Year or this coming, So come. We are here for you and we will give you the best. Shai-Osudoku District Hospital is yours. Access good health.